Good afternoon. I'm Bruce Greenstein, as I said, the Chief Technology Officer for the Department of Health and Human Services. I'm really happy to be here, and I learned quite a bit from the panel that was just completed. One thing, aside from the fact that there was not a lot of agreement on terms or data, there was certainly agreement that the patient's not properly at the center of this discussion around the country. And I think that's interesting. Even the way that we characterize whether it's an opioid epidemic or it's a crisis is not agreed on. There is something that is pretty clear. Last year, more than 64,000 people died in opioid overdoses. Think about that. So now it's the largest contributor to death for people 50 years and younger. In fact, it's higher than the highest year ever for gun-related deaths, 1993. It's higher than the spike year for HIV deaths, 1995. And so now it's the leading cause of death, and that is a crisis. Regardless of how we have gotten there, we have to do something about it. Today I want to talk about two things. I'm going to tell a little bit about what we do in the Office of the Chief Technology Officer. I'm sure you wonder every day, what exactly do they do there? And then I'm going to make a fun announcement about partnering with Stanford. But first I have to say, this is my first MEDX, and it is a humbling experience. I got here yesterday. I heard the end of the program. Yesterday, I had dinner with some participants, and then this morning, seeing and hearing patient stories. And it's something that ought to be part of the curricula for government officials that tend to think about healthcare in the context of hundreds of thousands and millions of people, rather than individuals and their story. Last night I had dinner with a guy called Hugo, and many people that have been doing this for a couple years probably know who he is. What an incredible voice for the patient. And he was telling me stories about why it's important to think about the patient. And I kept asking him, bring it down, narrow it down, narrow it down. Let me understand it in a very succinct way. And so at the end, he said in one line, he said, engagement takes two. And I love that because it's something that I could work on in my mind. Because what we do really in patient engagement is scale. My corporate career, my government career, we think about how do we do things across many states, across millions of people? Or how do we do it one-to-many? In technology, we come up with apps that are meant to take a little bit of time to write and design, and then they go across hundreds of thousands or millions of people. But in reality, we have to think about that engagement is one-to-one. And that's really what matters. That's how better policymaking will be done, and that's how we'll run our programs better, if we think that way. Okay, so the two things. First is what we do. In the Office of the Chief Technology Officer, we do, maybe we'll put it in buckets of three. We improve government performance. HHS is 79,000 people. It has the FDA and CMS, CDC, HRSA, SAMHSA, a lot of initials and acronyms. So massive programs that impact every aspect of healthcare. And inside of this massive agency, everything doesn't work perfectly, whether it's an HR system or the way we manage grants, the way we give out money, the way we collect information. So we help out there. The next thing that we do is we focus on partnerships, where maybe there's some large companies in Washington, D.C. with a massive federal sales team that really understand how to navigate the Byzantine maze that government bureaucracy is. But we want to see more small companies, entrepreneurs, startups have the same access to understand what our priorities are, figure out how to get in and show their stuff and how to learn from us. We don't do procurement, so we're not worried about giving away any trade secrets. We want to give access to all the people in the country the same kind of, say, technology or breakthrough in science and technology that right now goes to the commercial sector and skips the public sector because it's too complicated. And then lastly, we focus on data. So early on, Todd Park, Brian Sivak, and Susanna Fox have blazed an amazing trail to open up data for both healthcare, and it's turned out to be a worldwide phenomena. I just came back last night from the United Kingdom, and I was in their version of Health Data Palooza, or HIMSS, and there the head of technology for the NHS talked about a big announcement. 92 data sets were being released. They're part of the big data movement. They think that that's part of the key to figuring out how to improve quality and performance and engagement in their country. And it's pretty humbling that I get to follow in the footsteps and carry the torch on. And in fact, right now we have, if you go to healthdata.gov, we have more than 1,500 data sets for you to innovate on, use for research, give us some clues. And matter of fact, there's ways to provide feedback for us on that website. We're always trying to learn more and figure out how to improve what we can give back to the public. So that's what we do, and we're hard at work. The connection with data, though, is important here, because today I get to make an announcement. We are partnering with Stanford, and we're going to put on, in the beginning of December, the first National Opioid Summit and Codeathon, with, adjacent to it, the Designathon. So this is a big deal. In the last panel, you heard a lot of discussion about we don't have the data, we're not quite sure about something, or something's not very well defined. Well, there is massive amounts of data that's set up in ways that's very difficult to obtain, it's very difficult to run inquiries on, and it's not connected at all. It doesn't add the value that it ought to. So we're working very hard right now to pull these data together. We'll have a 2-day meeting. The first day is going to be some talks. There's going to be some short sessions, a lot like these, that are going to focus on, instead of government people going on, we're going to have people from across the country that have really put in practice great programs that are saving lives, improving performance, and helping people. And the idea is to share those experiences, these best practices, with other state and local officials, other healthcare officials, so they can bring them back to their community and help save lives, et cetera. We're also going to have a Codeathon, where we will release, a little bit before this, the nation's most comprehensive data set to address the opioid epidemic or crisis. And we expect researchers, entrepreneurs, policymakers, other government officials to join us in Washington, D.C., to work on these data, to answer the questions that you heard in the panel before. We have enough data to answer some very fundamental questions that are not being answered today, and we're very excited to, fully appreciate that we don't have all the answers, and we might not have all the best researchers that there are. So we're putting the invitation out to everybody here and anybody that's watching over the web. Come to DC. You'll see, we'll announce official dates pretty soon, but come to DC and help us out. Help extend the benefit that we can make to protecting people's lives, to improving the quality of life for those people that are either working with their physician and caregiver, they're using opioids, or maybe that we're trying to prevent people from using opioids on the illicit side. We're going to bring together data from healthcare, from 911, from Poison Control Hotline, Department of Transportation, and criminal justice to get a pretty good idea of what the supply chain of opioids look like, both prescribed and illicit, and figure out how we can be proactive in saving people's lives in the future. Our partnership with Stanford is very much appreciated, and really appreciate Dr. Chu's leadership in this area. So we'll be running, along with a Codeathon, a Designathon, something that's really focused on determining the best way to design policy and how to implement it to have the most important impact, the most profound impact on improving quality of life for people and protecting people's lives in this area. So I really hope you can join us then. We're very excited. First week in December, Washington, D.C. It'll be a little chilly, but it'll be a nice place to be. We've got about 1 minute for questions if we'd like to do that, if there are any questions in the crowd. Yes? There's a microphone for people that are listening online.
Sorry, it's just a logistical question. Is the Designathon in the same location?
It is. It's all going to be together in our headquarter building, the Humphrey Building in Washington, D.C., 200 Independence Ave, near the Capitol.
Yeah, I'm curious how would you characterize the current administration's view of opioids and addiction and all these issues?
Yeah, it's my boss is Dr. Price, the Secretary of HHS. One of his top 3 priorities is addressing the opioid crisis. So this couldn't be any more important and central to the interests and the resources that we're placing in terms of all the issues that we're dealing with today. Opioids is among the top.
Where should we go sign up to participate?
So, good question. I would watch for the Stanford MedX website for an early announcement on logistics. And we have to go through some official matters, public notice and Federal Register, before we put up the official website where you can then register and go online to get additional resources. So look for the Stanford MedX website first, and then you'll go to hhs.gov/OCTO, Office of CTO.
Yeah. Are you going to hold the meeting on a weekday or on a weekend?
It'll be during the week.
It's much easier for practicing physicians to attend if you hold it on a weekend.
That's
The
correct.
costs of leaving the office are huge.
Yeah, I'm aware of that.
I would prefer
You'd
that.
be able to do something online as well. Last question? Okay, 2 last questions. Sure.
What you said there's questions that were unanswered. What are the top 3 questions that you're curious that you could hope you could answer by fusing these data sets and getting these people together?
So the question was, what are the top 3 questions that we're hoping to use the Codeathon and Designathon to address? Thank you for asking that question, because we have a pretty good idea of about 10 questions, but we're looking for input from the community to really help us figure out what those 3 or 4 specific use cases that we're going to have the researchers address. So when you do go online, we'll have a place to get some early feedback. We want to hear what the community is thinking about in terms of what they're seeing on the front lines, what the CDC is finding. We're getting a lot of input right now. We haven't narrowed it down to 3 and said stop. We're right now open-minded, taking as much input as we can to determine what those top 3 or 4. So please send it. Afterwards, we could have a conversation, and we have some experts here that are working on it right now. Last question?
So hopefully this isn't too long, but as a software developer, maybe you could speak really briefly about one of the things I think for designers and developers that'd be really important is the problem is there, the problem's really interesting, but we want to be able to use modern tools and modern technologies to build software. The things we're using, maybe healthcare has been a little bit behind on using those modern technologies. So
that's charitable, but
maybe,
yes.
maybe briefly if you could talk about that.
Yeah, so we're partnering with a few companies around analytics and about building that are very savvy in building data sets for civic hackathons. So from those data sets, you'll be able to have access to both analytic tools as well as the data itself to be able to ingest it in whichever way that you prefer. If you're Tableau, Python, SAS, you'll be able to run your own analyses that way. As a matter of fact, one of our partners is going to offer a workshop for, say, researchers that don't have deep domain expertise in analytics. We'll have a free workshop the day before on analytic tools that we'll make available for the Codeathon. We are out of time, but
Hello. Great. Thank you, Bruce, so much for coming and sharing your time with us. The website is opioidsummit.org if you want to get some early information before the official one goes live. But thank you, Bruce. Let's give a warm round of applause for Bruce. Thank you so much.